My name is Kate Porterfield, and I'll be presenting today on Picher, Oklahoma, America's Ghost Town. The purpose of my presentation is to provide context for the Picher, Oklahoma environmental disaster, in which the town was exposed to decades of lead and zinc poisoning from mining operations. I'll be demonstrating the effects and impact of lead and zinc poisoning from a health and economic perspective, and finally I'll be discussing the intersection between two major environmental disasters with the occurrence of the 2008 Category 4 tornado. The following is my table of contents, in which I'll give a background of Picher, discuss the danger of chats, heavy metal poisoning effects on the population, the Category 4 tornado, and finally answering the question of what comes next for Picher. Located in the northeast corner of Oklahoma, Picher was the mining capital of the United States for a number of years. Between 1917 to 1947, Picher produced $20 billion worth of ore, with 75% of American bullets and bombshells from World War I and World War II coming from Picher Field. At its peak, more than 14,000 men worked in the mines, as seen in the image on the right from shaft at Black Eagle Mine. By 1967, there was an end to all mining operations, including an end to water pumping from mines into community water supplies. And at this point in time, Picher's population averaged at 2,500 persons, important for future data discussed in this presentation. After more than a century of unrestricted subsurface excavation, Picher accumulated mounds and mounds of chats, seen in the image below. A chat is a pile of toxic metal-contaminated mine tailings, which serves as the greatest source of heavy metal exposure within Picher. There's an estimated 178 million tons of chat, mill sand, and sludge divided among 30 piles scattered in and around Picher, some of which triple the size of football fields. These mounds were thought to be safe at first, and they became an integral part of Picher family culture, serving as biking terrain, training grounds for high school cross-country teams, and residue waste was used to fill driveway and sandboxes, which children played in for hours at a time. But by 1973, community members of Picher recognized an introduction of contaminated mine water into fresh water supply, signaling that there was something dangerous about these chats. And by 1983, Congress stepped in and named Picher as a part of the Tar Creek Supersun site by the EPA. These chats contributed to the highest levels of heavy metal poisoning within Picher. Heavy metal poisoning being defined as excessive exposure to heavy metals affecting normal body functions, including lead, mercury, arsenic, zinc, and chromium. They can enter the body through skin contact, inhalation, and ingestion, with toxicity resulting from both acute and chronic exposure. For context, in 1984, 17% of American preschool children had blood lead levels that exceeded 15 micrograms per deciliter, a number that's down to 0.54% today. Symptoms include nausea, vomiting, diarrhea, abdominal pain, and an increased risk of cancer, brain dysfunction, and changes in behavior. By 1998, more than 46% of children in the Picher-Cardin School District showed a degree of signs of learning disability. It's important to note that in Figure 1, which demonstrates population shifts in Picher, Oklahoma, there's a severe drop in population from 1920 to 1960, largely attributed to migration from rural to urban areas in post-war periods. Population maintained semi-steady from 1960 to 2000, losing about 1,000 persons over the course of the 40 years. Because lead poisoning and other heavy metal poisoning wasn't recognized within Picher until the mid-1970s, data that sources use for calculating rates of disease exposure only stems from data from post-1960 within the population, meaning that we're missing about 8,000 persons worth of data that could support the fact that Picher's had long-term lead exposure far before 1960. Table 2, brought to us from 2004 report to Congress by the CDC, shows disease prevalence in Ottawa County versus Oklahoma State. As indicated on the table, diseases including arthritis, asthma, myocardial infarction, stroke, and hypertension all had an increased prevalence within Ottawa County versus Oklahoma State, indicating that these community members were affected by lead poisoning, causing a concentrated increase in adverse side effects. The CDC used this report to vie for the fact that Congress should be buying out the town of Picher, allowing residents to relocate to other areas, which they could not do at the time due to low socioeconomic status. This report also included data from Figure 2, which demonstrates age-adjusted cancer incidence rates for the 5-area zip code, including the town of Picher, Ottawa County versus Oklahoma State. It can be noted that colorectal, cervical, kidney and renal, and esophageal cancer all had increased rates within the 5-area zip code in Ottawa County versus Oklahoma, with increased rates of cancer being a significant side effect of long-term lead poisoning. This data supports the argument that even though Picher was made a Superfund site in the 1980s, it was still no longer safe for residents to live in the 2000s, and thereby they should have been given government subsidies to move out of their town. But this was easily catalyzed in 2008 when a Category 4 tornado struck the town of Picher, causing extensive damage to 20 blocks of the downtown area. The tornado caused 150 injuries and 8 deaths and catalyzed an exodus of the city, with the government withholding aid to rebuild homes and instead opting to buy out homes for family relocation. By 2010, there were only 6 residents left in Picher, and this number decreased to 0 after the last death of a resident in 2015, as seen prior on Figure 1. Figure 3 is a spatial map of concentration of lead exposure risk by U.S. county, given to us by the Washington State Department of Health. As you can see on the map, Ottawa County, containing the town of Picher, still sits at a 9 out of 10 risk level for lead exposure. It's important to note that even though the town of Picher itself no longer has any residents, the lead exposure, which is sitting within piles of chat around the town, can easily be transmitted from county to county due to the fact that particles of chat can be relocated thanks to wind, rain, and other environmental factors, and further calls into question and concern the need of how the U.S. government will remove these chat piles. On a brighter note, though, Figure 4 shows the percentage of U.S. children in the United States with confirmed blood lead levels above 10 micrograms per deciliter per year from 2012 to 2017. It can be seen in the graph that the blood lead levels average between 15 to 17%, a significant decrease from the 40% statistic as we saw earlier in this presentation among school-aged children in Picher, and a significant decrease from a national average of the 1980s. This is a testament to the positive outcomes that the U.S. government has made from extensive work in reducing lead exposure on a national level. In summary, Picher, Oklahoma demonstrates the costly health and economic side effects of heavy metal poisoning, with the burden of environmental toxins falling not only on current but future generations of members of Picher, Oklahoma. With symptoms of lead poisoning spanning generations within Picher, Oklahoma, it proves the point that exposure to lead still existed within the community long after Picher was made a part of the Tar Creek Superfund site. This also calls into question the concern of the U.S. government's reaction time in relocating members of Picher, Oklahoma. A question I've wondered while doing this project was how much socioeconomic status influenced this reaction time. If these chat piles existed somewhere like Westchester County or Fairfield County outside of New York City, would it have taken 3 decades for families to finally be moved the way that it did for low-income families in Picher, Oklahoma? This can't be addressed in this short presentation, but it can be used to signal the influence of environmental classism and how we respond to environmental health crises as a nation. Thank you for your time.